So good morning, everyone. Welcome. I do realize there are only 16 participants currently, but we'll let them in as they arrive. But to respect everyone's time today, we will go ahead and get started. Of course, don't be shy. Turn your cameras on if possible. Remember to mute and unmute when you want to share your thoughts. And of course, mute for background noise and use your chat to address any questions or technical difficulties with us. Next slide. Okay, so we're at meeting 3. Oh,
You know what? Let me see why this is not the correct slide. I'll be right back.
no problem. And for those of you who are just joining, please use the chat to put your name and the organization you're representing in the chat box. I should have had some on-hold music for you. Ah, there she goes.
All right. Yes. Sorry about that.
That's okay. All right, welcome, meeting 4. So this is the good stuff. This is the grit of it all. Disabilities, education, and family and community engagement. Next slide. So this is our agenda. We'll do our icebreaker. We'll go over the process overview and go through the education, disabilities, and family and community engagement, not health and safety. And then next steps. So many of us have years of work experience. What was your first job? Think back. Some of us may have to think back a little bit further, but what was your very first job? And feel free to use the chat. It's okay to unmute. Savannah, the Hyde Park Movie Theater. Maria was a teacher. Shelby, ice cream scooper. Laura, babysitting. Samela, you work for the unemployment office. How fancy. Accounting downtown for Joanna. Soraya with Edmar Foods. Another movie theater, Cynthia. We have some babysitting. Oh, look at Sung. He was a janitor. It's Willie Walgreens. Shamara Doctor's Office. You have Latoya with the Park District. Oh, gift wrapping. Marty's Candies. Are they still open, Berenice? Miriam.
They are since like 1920s. Okay. Yeah, it's been there for a long time.
Well, look at that. We've all come full circle. So is anyone currently doing anything related to their first job? At the least. Trying to go through here. No. No. All right. Well, it's okay. It was a starter. It was our stepping stone. That's how we started. Okay. Pamela said yes. Cynthia, you like popcorn too? Me too. Me too. My first job was at a shoe store in high school. So I enjoyed it, and that was probably my first retail job, but that's okay. Anyone else want to share, and we can move along? Go ahead and go to the next slide. Thank you. So this is our last and final session, and then we'll go into the quarter 3 meeting in July. Next slide. So where are we in the process? So of course, today you've attended these weekly meetings during the self-assessment process. And of course, even for the quarter 3 meeting, if you yourself cannot attend, please send a proxy. We'll be reviewing evidence of grantee performance. You're going to identify some program trends and make recommendations for priority programming for the upcoming year. And of course, provide recommendations for the next year's self-assessment process. Next slide, please. So here are survey results among 70 total responses. Next slide. And we do have experts in each of these areas: disabilities, education, and family and community engagement. So I would suggest doing the same thing that we did yesterday. Who do we have on the call from disabilities?
Hi, Martise. Good morning. This is Gina Pasella, the CPS DFSS Disabilities Team Facilitator, and some of my team members are with me.
Okay.
And we also have the Erickson team, Martise.
Okay, great. Thank you and welcome.
Thank
Okay,
you.
so Berenice, you can start out by reading the first question.
Sure. What are some strategies that CSD are implementing to create disability awareness for parents who has sufficient evidence?
So
Right.
Gina,
Martise, our interpretation of that is, how are we educating families who may not be aware that their child may be exhibiting symptoms or behaviors of a suspected disability? And we often encounter that, obviously, in birth to 5. And so some of the ways in which our team helps to create disabilities awareness is to conduct training for parents on referral process, the purpose of evaluation, services at Chicago Public Schools. We also do individual child observations in the field, and we meet with parents as a follow-up along with our disabilities coordinators to discuss specific children and their developmental concerns. So those are some of the ways in which our team supports this. And so perhaps the Erickson team and the other, the DSCs can speak to that.
Yeah, I think that we also would echo that at the Erickson team. I know we also try to work with teachers to help them kind of understand more about the screenings that we use and how to talk to parents about the screenings, about the results in a way that's appropriate for parents and in a way that makes sense for them. So individual observations, training, talking to families, talking to kiddos, talking to teachers are all great ways that we also use to support families in learning more about disabilities with their children.
In addition to that, Martise, I just want to add that we also have collaborative partners. So we work with StarNet, we work with the Resource Center for Autism and Developmental Delays, and we kind of partner with them to educate families about suspected disabilities. One we have coming up is about advocating for children who have autism spectrum disorder. And so we also work with StarNet to develop trainings for our annual training calendar. I know this past year we've done one for parents specifically about understanding disabilities. And so just speaking more to that.
thank you, Gina and Shelby. Do any of the agencies care to chime in or express any concerns regarding the disability awareness? Okay, moving on to question 2.
All right. What are successful strategies in CSD, seeing when it comes to providing support for teachers with multiple individuals with disability?
This is Gwendolyn Carr. One of the ways our agency tries to provide is more teacher's assistant. To put, if we see a multiple of individual with disability, we try to put instead of 2, but 3 teachers in the classroom to help out with the disability. Right now, we don't have a professional. We do have teacher's assistant, actual classroom.
I'm sorry, Martise, I was having difficulty hearing Ms. Carr.
Yes, Ms. Cart, I heard just a little bit, it was muffled. I realized that, look, class is in session currently. If you can you put some of that comment in the chat for us as well, please and thank you. And anyone from the disabilities team can chime in on some strategies. And if not, we're going to move on to question 3.
Martise,
Hold on one second. Sorry. I just realized that I hit the wrong mute button, or I hit the space bar instead. So I think doing those individual observations can be really helpful with supporting teachers with kiddos with multiple disabilities, helping them individualize lesson plans in their classroom and kind of doing that one-on-one work with them to support, because I can only imagine how stressful it is to be in the classroom all day. And doing the work and being fully immersed in it. So trying to support teachers on that one-on-one. And also, I think Ms. Carr mentioned too, talking to administrators about adding more support people, TAs, into the classroom to support kiddos with higher needs, or classrooms with multiple kiddos with higher needs.
Thank you, Shelby and Gwendolyn.
and
Anything else?
Martise,
Yes.
I'm so sorry, if I could just add to that, in addition to that, the training and technical assistance that our SMEs provide, it's agency specific, sometimes it's site specific, classroom specific. We do have an annual training calendar as well. And as I mentioned, we provide resources to the teachers. That could be RCAD, that could be our CSD updates, in which we provide, the mental health corner for staff wellness. It could be the disability section where there's trainings and resources for them. In addition to that, in their budget, there should be funding allocated to support disabilities. And so if there's opportunities for like professional development beyond what DFSS provides, there may be an opportunity for that. Some agencies also fund paraprofessionals. And so that if in fact that is the case, that definitely assists teachers in the classroom and supporting multiple children with disabilities. And so that has been very successful. And then I just want to offer if my team has any other additional responses for this area, if they could please contribute.
Well, thank you, Gina.
Thank you, Martise.
Question 3.
How can CSD assist with connections to stipend for daily transportation services to CPS?
So if I could ask, we interpreted this question in 2 ways. And the first was, we were wondering if this is referring to the Chicago Public Schools stipend for transportation services so that children can receive their IEP services, or rather, does this refer to CSD partnering with community vendors to perhaps stipend funds to provide services when Chicago Public Schools does not? So we just need some clarification on that, Martise.
So these questions actually came directly from some of the agencies. So if anyone from an agency would care to speak on it and clarify for the disabilities team?
Can you hear me? This is Ms. Carr.
Yes.
Okay. Now, can't start talking. How they assist? You mean we had a stipend? We walked our children to their, well, if the school was closed, we walked our children to their, to get their services at the school. Now, if the school was not closed, we had to provide transportation there and back. There was a stipend. We provided the transportation for the children that had services that CPS Plus did not pick the children up.
So Ms. Carr, that was still a little muffled. We heard the children more than we heard you, just a little bit. So could you put that in the chat, and then Gina could probably address it so that we know, exactly what you mean.
I believe the question also came from Kimball Daycare. So I believe they're on the line, so they can jump in.
So Kimball, if you're out there, go ahead and unmute. Meanwhile, we will transition to question 4.
All right.
Martise,
Sorry.
Martise, I'm so sorry. This is Gina. Can we go back to question 3 for just a moment?
Yes.
Thank you so much. So it sounded, I was having a difficult time hearing Ms. Carr as well, but it sounded as though she had said that their program provides the stipend for CPS transportation. Did you hear that as well?
I did. This is Bernice.
No, I barely heard anything, honestly.
Okay, let me just take a look at the chat if I could.
So the chat, I think, is referring to question 2. So I'm going to read that from Laura Brown. Successful strategies. She writes, providing individual child observations, classroom observations, and providing additional training and technical assistance to the classroom teachers, DSCs, and education team on best practices and ensuring inclusion of children with disabilities in the general education classroom setting, utilizing the IFSP and IEP to ensure individualization based upon child goals, IFSP, and accommodations and modifications identified in the child's IEP. Thank you.
Thank you. That's excellent.
Yes. So Ms. Gwendolyn Carr did submit a comment here. She writes, we provided transportation services for students who had only speech. We don't provide stipend.
Okay, that's very good. So if we could provide responses to question number 3, and I can kind of tell you with our team's brainstorming, some of the thoughts that we had. And again, hopefully we'll hear more from the agencies because this process is really intended for them. So I'm not sure if we could maybe allow them a little more time to unmute or something. But again, I think we want to hear more from the agencies, right? Martise, Bernice?
Yes.
Okay,
So don't
great.
be afraid to unmute.
Yes. So when we talked about our team, the CPS team, connections to a stipend, whether that be CPS stipend or if agencies are providing funding for children to transport to services, we definitely thought that we connect parents to the Chicago Public Schools Student Transportation Department in order to determine eligibility for the CPS transportation stipend. And so we actually have an email address in which we refer families, and maybe I can provide that in the chat. But our programs, if they're ever wondering, does this child qualify for the CPS stipend? Usually it's around $500 per month. And then the family has to agree to it and secure their own transportation to services. They can email this CPS address and get answers to those questions. So we thought that was one way in which CSD assists programs and families in connecting to the stipend. And then the other is that we provide updates in the CSD weekly blast, telling families when there's transportation changes and so forth. One topic that came up was for extended school year this summer, whether or not children would be receiving the same transportation services to and from for ESY or for summer school. And so programs can look to the CSD update for those questions. And then also in the past, when we were brainstorming about, children accessing services and how we can facilitate transportation, we assisted DFSS in compiling and updating a list of bus vendors or transportation vendors in the community who we might consider partnering with if Head Start was agreeable to that. Because we know Head Start is a dollar of last resort. It was kind of intended to be a plan B if in fact CPS was not providing it. So those are just some of the things that our team talked about. And again, if we could hear from the delegates, the agencies, that would be ideal.
And again, agencies, this is your platform. You can unmute and say whatever it is that you're feeling about, this topic or any of the topics that we discussed today.
I'm sorry to do this, but I think I'm going to call on Giselle Mojica if she can unmute, because I know you submitted this question. So do you have any additional comments or questions?
Yes, so we were referring our parents also to CPS for transportation. And many of the parents were able to receive a stipend, granted that they were able to pick up their child and drop them off to and from school, so that they were receiving either $500 lump sum for the stipend of transportation. I did have a question about summer school transportation, but I'm just waiting for a response on that.
And if you want to reach out to your CPS SME, we're here to assist you about questions related to transportation, ESY. So please feel free to reach out to us.
Thank you.
And Martise, I'm going to put that CPS web address or email address in the chat box.
Okay, thank you.
Thank you.
We can progress to question 4.
Okay. How does DFSS ensure and confirm the linkage of services to therapy implementation with each child?
Bernice, who submitted this question? Do you recall?
Let's see, I believe, I don't want to say, it might have been Pods. So I believe Ms. Devana might be on the line. Yes, I believe it was Pods, Project.org.
Ms. Devana, please share your insight on this question.
I'm gonna get out the queue. I'm sorry, I can't see. I had to minimize the screen. Can you read the question, please?
Sure. How does DFSS ensure and confirm the linkage of services to therapy implementation with each child?
The linkage. Oh, just making sure that it's a follow through. That's the only thing I was saying. Just ensuring that there's follow through. Is there a data system? Is there data that shows that there's follow through?
So Gina, does anyone from your team, can they speak to the linkage of services to therapy for children?
Certainly, Martise. We again brainstormed together and came with some collective responses. So let me share those with you. And then beyond that, if my team has additional thoughts, I would ask them to please share them. So we want to always, all of us, ensure that our diverse learners are accessing their services at the local education agency, whether that be our birth to 3 students, that they're accessing their early intervention services, or for our 3 to 5 population, that they're accessing their services at Chicago Public Schools. And ultimately, if this is the parent's wish, because we do know that there are a certain number of families who decline those services. But when in fact the family does wish for the child to receive those, we want to ensure that that happens. And so our subject matter experts are here, and we provide training and technical assistance to help the families understand the service delivery options in terms of the providers coming on site to the home, and Shelby can speak more to that for EI, but in terms of Chicago Public Schools, understanding dual enrollment options, meaning that the children can be enrolled at Chicago Public Schools for their IEP services and then also attend our Chicago early learning programs. And so we every day troubleshoot service delivery access issues, whether that be with school assignments, school enrollment, transportation, and all of you know this work as well. We all work together to ensure this happens. I would say on high level, we have the memorandum of agreement, which is the partnership agreement that facilitates all of this work. So we have streamlined processes in which children can receive those services. We've got great systems in place in which our programs understand that families receive school assignment letters, that they're following up with the families to make sure that they receive those. When families move or relocate and there's a change in address, our DSCs communicate this to our SMEs, and we make sure the letters arrive to the families. And this is every day of the year. In addition to that, for ESY, we're talking with families right now and whether or not their child is eligible for ESY. Will they be attending? Do they have the transportation worked out? And so these are just some of the things that we think about. We also monitor compliance of service delivery in COPA. And so we actually added drop-down fields in COPA a few years ago to say, if a child was not receiving services, what is the reason why? Because we ultimately want 100% of children to receive their services. And so if it's parent refusal or awaiting school assignment or lack of CPS bus transportation, we as a grantee are really trying to capture what the issues are and to help resolve those with you. What I will also add, our team talked about the CPS monthly transition meetings that CPS has with families to connect them to evaluations and services at Chicago Public Schools. And our Chicago early learning programs are invited to participate in those monthly meetings. They are virtual, which is beneficial to increase participation. And then with parent consent, we always ensure that the children are receiving the required services. And so all of those things are kind of what we talked about as the CPS team. And so I would ask if my team members have any additional thoughts. And then if not, we can turn it over to the delegates.
Gina, I think you covered it all there. Great job.
Yes, that was a great explanation. Thank you so much. I just wanted to make sure that the data was being captured. Thank you.
Thank you too. And Shelby, do you want to add to that anything birth to 3? I started talking about providers coming to the home or to the Chicago Early Learning Program, but perhaps you'd like to speak a little bit more to that.
Yeah, so with early intervention, providers can be in the home or in the school, whatever environment the parents would like the child to receive services in. So on the 0 to 3 side, we spend a lot of time coordinating with the CFCs and the early intervention team to make sure that kiddos are getting their assessments and stuff done at the CFCs. Make sure they're getting their IFSPs, make sure you all as teachers are getting copies of the IFSPs, and then in turn making sure kiddos are receiving the services that their IFSP says they need.
Okay, thank you.
Thank you.
At our agencies, I don't know if they're required, but best practice is also for documentation, not only the COPA system, but to have a disability file on site, you know, in a confidential locked cabinet, which kind of is a recommended best practice, but you know, best, oh, what am I trying to say? A place to keep all those important documents.
Absolutely, Laura. I agree.
Great, thank you. I think we're going to move on then to question number 5. How does DFSS ensure agencies are securing the medical equipment needed for parents and families?
And Bernice, while the team or the agencies are thinking on that, perhaps I can offer some of the brainstorming that our team discussed. So when we think about medical equipment, we also understand that Head Start is the dollar of last resort. And so it is our understanding, and this really falls into the health realm more so than disabilities, but it is our understanding that other funding streams should be exhausted before Head Start would consider funding medical equipment. And so if the child has a medical card or private health care insurance, we would likely look to those sources of funding prior to Head Start dollars. But as we mentioned, there is a budget line for disabilities. And so if families or parents, children require medical equipment, we would probably look to the budget department, finance, health to talk about what that looks like. We do know that, for example, if the child needs glasses, we do have some vouchers for free glasses for children, depending upon what's needed. We weren't certain if the agencies have cooperative agreements with medical supply companies or if they work with their vendor, their health vendor for that need. But in the past, we had a child who required a wheelchair and the child did not have medical insurance, was new to the country. And so our program, our Chicago Early Learning Program, worked closely with the family to, complete the paperwork for a medical card. And in the meantime, located resources for wheelchairs for free. And so we all kind of work together, disabilities, health, finance to meet the family's needs. Those are just some of the thoughts our team had with regard to medical equipment, but I would definitely turn this over to the agency so that they could talk about it from their perspective.
Thank you, Gina. Yes, Devana, did you have a particular, maybe instance where this might have happened, or do you want to elaborate a bit more?
Maybe Catherine Moore can elaborate on a little bit more. I'm sorry.
Sure. Catherine, feel free to unmute yourself.
Okay, so I'm sorry. The question you're asking is about whether or not we're going to be able to access the different services for the client.
So the question that I have here that was submitted, how does DFSS ensure agencies are securing the medical equipment needed for parents and families?
Well, I've been working with the disabilities coordinator for that's been working with the PI program, Miss Jody Anderson, and she's been making sure that we are in contact with the CPS in order to make sure that we get the quality, the services that we need and the equipment that we need for our clients. So that's how we were going about doing it. I don't know if there's another direction or another way it could have been done, but she's been very helpful with us in securing and being our liaison between CPS and our program.
Okay, so Gina, from what I understand, then what we're saying is that there really isn't a system in place, but rather agencies are contacting the CSE staff and then just different units come together to resolve that need. Is that correct?
Correct.
Catherine, are you referencing, this is Laura, are you referencing maybe some of the students that are enrolled at pods in your early intervention, or like birth to 3 or 3 to 5? It's birth to 3, correct?
We
for-
have a home visiting program for prevention initiative. And we were working with a couple of clients who ended up needing some medical supplies. And we were working with Jody Anderson through working with her, and she was a BNI liaison with CPS.
Okay, great.
And she also helped us with, we had two clients who needed transportation because they were in daycare part-time, and then they were getting services part-time. So she helped us with transportation, where the transportation picked them up from the daycare center and took them over to the CPS school in their area, and they were able to get their services there and then transported them back to the daycare center.
Yes, okay, I know who you're talking about. Yes, that's.
Yeah.
Okay, wonderful.
Mm-hmm.
Thank you.
Great, okay. And so agency submitted a request for, sorry, is there anything else that the disabilities team would like to comment on this last question, or we can move on?
Can I just make one more comment?
Sure,
Erin?
definitely.
If in fact there is any equipment that is identified in a child's IEP, that is provided by Chicago Public Schools. And so that's just one point I wanted to make. It would be provided by CPS if it is indicated in the IEP.
Thank you for that point.
Thank
Very
you.
important, yes. Okay, so we also received a request for documents, and the committee wanted to view disabilities monitoring form, social work acknowledgement tracking form, early intervention referrals, observations, ASQs, questionnaire scores, ASQSE from COPA, referrals, and progress. And so we can go ahead and share that with the committee at a later point. So I'll be reaching out to folks on the disabilities team and the operations team. Okay. Thank you so much, Gina. We really appreciate your time. Okay, so we are now moving on to education, and see. Okay. So we have these 4 questions that came in from the self-assessment committee as well. So we have who from CSD is going to jump in and answer these questions for us today regarding education?
Good morning, Bernice. I'm here, William Hill.
Okay, great. Okay, William, I can go ahead and read off the questions if you like. Number 1, how is DFSS measuring success in teacher retention?
Great question. So currently, we are here at DFSS, we use our COPA system, our COPA database. And so we do know across our field, not only here in the state of Chicago, the state of Illinois, but across our nation right now, we are experiencing a shortage of educators, primarily our teachers of our classrooms. And so one of the things that DFSS is doing now is really using our COPA system, working with our agencies to update teacher information, teacher profiles their way. So therefore, we're able to now begin to track our teachers and how long they're staying within our agencies. And so that's something that, with the self-assessment, it was something that really highlighted the need to ensure that we're effectively tracking teachers' retention. And so at this point in time, we're still laying down the framework for our successful tracking of teachers' retention as it relates to their individual agencies, the point of time in which they started the programs, and then if they're making any lateral moves within the agencies. Let's say teachers are, begin the EHS and then they move over to Head Start 3 to 5 program. While we see that teacher is moving from one class to another program, that teacher was still retained within the agency. So we're working on some of those metrics as we speak.
Thanks for that, Will. Is there anyone, any agencies here that would like to comment on teacher retention while we're still on this question? Just gonna give it a few seconds. All right. Okay. So question number 2, are there independent studies DFSS has initiated to identify and address teacher and staff turnover?
No, there's no independent studies. But one of the things that we are doing to combat and address teacher and staff turnover is through our Chicago Early Learning Workforce Scholarship Program. It is a Chicago-wide initiative in which it's open for not only our staff that's currently working within our CBO programs, but also residents and college students who are interested in joining the field. That to me is a great way to address teacher and staff turnover, because again, we have vacancies. And so how are we supporting driving and growing our workforce? And by that scholarship is one of the ways in which we can benefit some of those vacancies and address some of those vacancies within our classrooms and programs.
Thank you, Will. And just a follow-up question to that. How are agencies informed of these scholarship initiatives?
So we of course put them out through our CSD updates. And we also have it on our Chicago Learning website. We also hold, my team put out news blasts when we hold these kind of brown bag lunch sessions, in which we are inviting any interested staff, education coordinators, to come and get the information and kind of take back to their teachers if they're not able to join those sessions, to really learn about this last dollar option for our teachers and our staff to again grow their education, advance their Illinois credentials, and again ultimately to retain and grow our workforce.
Great, thank you for that. And is there an open applications right now, or when is
So
the
currently,
next?
no.
Okay.
No, our application has closed for this current program year.
Mhm.
We have already enrolled for our fall. But again, it will be open, I believe, in October or so for the fall. For the spring terms.
Okay, great, thank you. So for agencies that are on the meeting, please make sure to look for that in the fall and let your staff know.
Absolutely.
Yes. Okay, so we are going to move on then to question number 3. How does DFSS ensure that agencies understand the requirements in terms of reports and performances?
So one of the great things we offer here at DFSS for our partner agencies, our sub-recipients or delegates, is our Chicago Early Learning Workforce Standards Manual, the CELS. In the CELS, we dictate and prescribe all of our program requirements, performance measures, and there's some great tools inside the CELS known as our milestones. And so it literally breaks down some of the tasks, the importance of some important tasks that should and due dates as it relates to monthly, quarterly, annual cycles of reports and reports and tasks that are due and when they're due. We also work with our agencies of doing our roundtables, in which our teams come together and we meet with our agencies and discuss the work and the outcomes that has been taking place within those prospective agencies within that year. We also work with intentional and intensive training and technical assistance opportunities, in which we see if agencies are need extra support in any of our content areas. We have teams deployed and even through our support service contractors. If it's speaking of education, if it's around curriculum and if it's around curriculum to fidelity, we will work with our internal team to support our agencies, but also we will link them with our teaching strategies gold contractors who can give them more intensive support at all levels of the programs.
Thank you for that, Will. Yes, if there's any agency staff on here that would like to have a follow-up question, the time is now. If not, we will move on. Okay, so I'm not hearing anything, so we will move on. Question number 4, how does DFSS monitor or track professional development of agency staff?
Well, as we know, in our programs, it is a requirement of the 15 continuous training hours annually that's mandated. But then beyond that, as we think about continuous quality improvement, the goal is to really perfect, as we are doing in our self-assessment now, is addressing issues, is identifying some gaps, noting our strengths, and identifying some areas of growth. And so with that, we have an intensive TNTA plan that our team worked to provide trainings throughout the year, in addition to those regular 15 hours of training, which you pretty much see with your mandated reporter, your SIDS and shaking babies. But in addition to that, I mentioned some of the things we do with teacher strategies. Also with our Teachstone class is very important. It talks about, it focuses on the interaction between teacher and students, the environment. And so we have an extensive list of trainings around our class modules. We also work with SGA for mental health, and a host of other service providers to provide those trainings as it relates to professional development. But how we track that is through our COPA system. Every teacher, every staff, every support staff member must register for our trainings via COPA. And then we also use our Illinois Gateway system as well. Our Gateway membership numbers are important. They should be requested at all of our trainings. And so therefore, all those things go into what we call our professional development record, or PDR. And so it really encapsulates all of the trainings we've done from the duration of your career. We're able to go back as far as many years as you've been a member in Gateways, and pull that PDR, and it will really show the list of all your trainings, almost like a transcript, from your college or university. Another thing that's very important here at the DFSS is our professional development plans. These plans are super important, not only for teachers who are currently working in programs who are needing to reach requirements as it relates to their education and or degree, but it should indicate their goal. Let's say I have an AA degree now, my goal is to get an BA degree. That goal should be identified there, but also the steps necessary to get there. I need to enroll in the college or university. And then, or maybe I may take part of the Chicago Early Workforce Scholarship Program. And so that would be a step to be accepted into the scholarship program. And then the next important step is to update it. I have been accepted. I have enrolled in school. I have completed my first semester, completed my first year. Those things are very important. So therefore, we're seeing this professional development plan, not only the goal, but then the updates as we see that this person is taking the steps to complete that goal. And we look for those to be done annually, as annually as just a requirement, but best practice is quarterly, especially if the teacher is currently enrolled in school or completing those necessary steps to, again, obtain the degree and or even level up in their Illinois ECE or IT credentials, Illinois director's credentials, etc.
Great. I don't know if there's any agency staff here that like to comment on their progress or their status on professional development plans for their staff. Okay.
Are there any questions?
Yes. Just going to take a few seconds then. I don't see anything in the chat.
Okay, thank you so much, Berenice, for your time, and thank you, team.
Thank you. So we're going to move on then next to the survey questions that agencies responded to. Let's see here. Okay. So this is an education question. How has COVID impacted the classroom environment, staffing patterns, and data entry requirements? So this question was an open-ended question. So I only grabbed two quotes from, or two responses from this question. So staffing patterns, difficulty filling vacant positions, taking significantly longer than pre-pandemic, extended staff absences due to illnesses or household members being ill, challenges with substitute teacher coverage due to staffing shortages at temp agencies, Classroom environment, we're continuing to mask, which can impact language development, particularly for children with speech language delays, but teachers continue to work diligently and creatively. No significant impact on data. Thank you. The second quote that we grabbed is, staff have felt a disconnect with many families. We did not allow parents in the classroom nor to volunteer in person this year. Staff have also had fewer interactions with one another, which at times brought morale down. Many staff had COVID themselves, as well as their children in the homes. Because of COVID, staff stayed 6 feet apart from colleagues, and children wear face masks, have extras available just in case, do not shake hands or share items. Everyone uses hand sanitizer before the day and throughout the day. Wipe down the areas, fear of data entry to computers or shared items. Laptops were purchased to this need and need to conduct data entry at home. Gotcha. Yes, we know that they're doing everything right, staying apart, making sure that they're cleaning and also using hand sanitizer, but there's definitely some effects that come with being socially distanced, and we can see that. Okay, I'm going to continue on. So question number 22 was, how has your agency adapted their practices in supporting teachers, classroom staff, and ensuring that children are continuing to learn in a virtual environment? So I know Martrice, I don't know if you want to take it away from here.
Yes, thank you. Okay, so, oh, wow. All right. So the responses were pretty much spread out. So with training, there was a 58% response. The DA education managers, 21%, external trainings, 45%. And then someone put, our center does not offer a virtual learning environment. So it's roughly 26 agencies. And then other is 28%. I'm curious as to what those 20 responses, like what does the other mean? Are there any agencies that care to speak to the virtual learning environment?
And I can look into what agencies responded to other in terms and can bring that up or follow up with that.
Okay, no problem. And you want to go ahead and go to the, thank you, the next screen. And this is just in the bar graph form, that's all. And you can go to the next screen. How has your agency adapted their practices in supporting parents in ensuring that children are continuing to learn in a virtual environment for the program's design? So workshops at 58%, family support specialist worker 51%, education specialist 38%, parent meetings 64%, and other 51%. Berenice, do you know if the other, were they able to put in comments to specify like what
Yes.
the other meant? Okay.
Yes. So when I download the results, as you're seeing here, unfortunately, it doesn't capture the I'm going to say the qualitative aspect of it. And so I can also come back and follow up with that in an email.
So it does, well, it is appearing that the agencies are utilizing all the staff to make sure that parents are feeling supported. And that's good. And I know that parents value and appreciate that, you know, as we toggle through COVID, which has not gone anywhere. So hopefully the new upcoming school year will offer new things. The next slide.
You know, I actually have access to the SurveyMonkey, so I can read some of these other responses. So we have an agency that mentioned, we do not offer a virtual environment for children, but have offered some parent-teacher conferences, parent meetings, workshop trainings, virtually for families with really great engagement and results. Okay. And then there's some that just say, we do We do not service virtual learners at this time. Some were not applicable. Okay, I'll go ahead and move on.
Okay, thank you.
So now,
So we have family and community engagement. You can go to the next slide. So there were only 2 questions. So the first question, how does DFSS ensure agencies understand the scope of services offered by subject matter experts? So Will or Tamela, do you care to share?
That is a great question. How do we ensure agencies understand the scope? Honestly, in the subject matter experts are our SSCs, and I believe some are here as well. But it's really understanding what their role is to the agencies. And I think Bee kind of touched on it yesterday, when she stated, like, you're supposed to reach out to them when you're in need, especially in this area. And I know some things have been transferred over, so I'm very new to this FCE, but I don't know. I see Will cut on his light, so jumping in.
Sure will. Thank you, Martrice. Thank you, Tamela. And so one of the things, as Tamela just mentioned, is about the connection and the communication. Currently, our family community engagement support service contractor, the SMEs, is UIC, and we know they're very present. We know that we promote and we provide their list of trainings. And so therefore we know our agencies do sign up for our trainings via COPA. But again, even outside of those trainings, these support service contractors, or SMEs, subject matter experts, are there to then support you all, our agencies, beyond that training piece. And so reaching out for them to support our FSWs and supporting our families is the very important piece about our family and community engagement. As we talk about father engagement, as we talk about those family goals, that's pretty much what if a family creates a goal in partnership with the family support worker, and so the community partnerships that you as the agencies have, if they don't reach out and offer that kind of comprehensive support for those families, then that's where our family and community engagement, the UIC, will come in, because then they are able to then tap into some of their community partnerships to aid that parent, again, adult learning, those GEDs and ESL families, et cetera, like that. So again, it's about that communication, but again, this self-assessment, that's something to take away. There's something to take away from the self-assessment process. Better ways in which we can work with our agencies to describe what each one of our service support contractors do and that scope of work.
If I was to add one more thing, and I totally forgot because I just did federal review, I don't think we advertise the children's service page as much, because all of that is actually located there, but we don't redirect, especially our new agencies, our new site directors, our new staff, to that page where it is a list of resources. And if you click on there, all of UIC, it links you to UIC page. I think CSD does a disservice in not advertising what we actually have. So I hope that answered the question, Bernice.
so question, so you're referring to UIC, the Children's Center?
The literacy, what is it? Literacy Center, I believe. Yes, something like that. It's a long name.
Okay, because I can literacy center, I can look it up and put it in the chat if that's the correct one. So it's the Center for Literacy, is that?
Yes.
Yes,
Okay.
CFL.
CFL, okay, great. So I will put that in the chat. Okay. And just a follow-up question, how many subject matter experts do we have within the family community engagement piece?
You have two,
Okay,
because Start Early supports our curriculum, and they also do some TNTA with those family support workers around implementing the curriculum and center-based and home-based. And then you have UIC.
great, thank you for that.
Mhm.
Okay, well, if we don't have any further questions regarding the subject matter experts, we can move on to question number 2. How is DFSS tracking how agencies support their sites in terms of community partnerships? And how is the impact of services from community partnerships measured?
That is a great one. I know we are able to track through both our monitoring team and as part of our checklist when we come out to the agencies. Also, case notes, and we actually look in those binders. We are still in binders, y'all, to monitor how many partnerships agencies / sites have. It's important. It's important. And again, yesterday, I think we learned how important it was when Bea was talking about that mental health and dental and doctor partnerships that agencies should have in order to provide services to those children and families in need. The impact part is where I think DFSS struggled. And I think I asked that part of the question. I think I asked this question. But and I think we need to actually ask the sites in terms of, are the partnerships really meaningful to your agencies and sites? And I'm just going to use an example. I live on the corner of where Pathway site is, and they put out a big banner, thank you for 20 years in the Ashburn community, because they knew that they were having impact. They have a great relationship with the schools and almost every store around here. So I know that if Pathway was not here, this is an agency that is servicing birth through 12 years old. So they are having impact because these parents have somewhere for aftercare, summer care, all of those things. So, how are you guys measuring the impact in your community? If your enrollment is low, are you having impact? Do you have those connections with partners? I don't know. That's how I was thinking about this question. Are you really a family to your community? I don't know. I'm asking agencies at this point, so I have to turn the question around.
Yeah, if there's any of our agency staff that would like to comment on this, please do so.
Hi, Bernice and Tamala. This is Angie from ADAS McKinley.
Hi, Angie. Yes, please.
All right. Just to say, I know we're not really develop our system for tracking, but I think working with the families, especially with the community partners, I think if we get great feedback from the parents, then we know what partnerships are working for us. One of our wonderful partners is with the Chicago Furniture Bank. And that has really helped a lot of our families, furnish their homes with just a small amount of money when they, if they have it. So that, because we always get the feedback from the families, they were able to furnish their whole house for $250. So every time we use that, engage in that partnership, the families they get what they need and it works. And so with our other partnerships, the same thing, if we continuously are referring our families to those agencies, and they're getting what they need. And they are also helping us in some ways, whether it's with recruitment or just, making sure that we are abreast of additional services in which they have, notifying us all the time of events in which they have. I think if you have that feedback from the agency that you partner with, and then you get great feedback from the family, you can kind of gauge how that partnership is working. Because if you don't have that, then I certainly wouldn't continue to refer any families to those partners, because we had dental providers that we had in the past. And, some of our sites was like, can you give us another one? Because that provider is really not child friendly. They're doing the exams, but they're really not working well with the children and families that we serve. So I think listening to our clients that we serve and looking at what the providers are able to provide to us and how it's benefiting our families, that's a way to gauge it. And I think if, just a simplified version, if you just do a little rating scale on the partnerships in which you have within a community. And just to speak on the UIC literacy program, ADAS McKinley has been, with DFSS a long time since I've been here. So, so I know about them. I know in the, before the pandemic, when we had our subcommittee meetings, at the King Center, that will be the opportunity for us to meet UIC and any other partnerships that the city has. So I think that, if we just, get back to that, whether in person or virtually, so that we can have those providers, those partners coming in and just introduce themselves to all of the agencies that are under DFSS, because we have worked well with them. We know they exist. Just, I think maybe a month ago, I actually had Sarah and Jay come out to do just an informational meeting with my team of family support workers, only because I had a new staff, but I knew that we were not really utilizing all of their services. So just to get them a brief summary of what they offered. And they offer things not only for the families, but also for the staff, the one-on-one coaching. And that has really helped. They're actually working with us now with a staff member so that they can meet their family specialist credential by the deadline. So I think just if we have opportunities for those partners to come out and meet with the agencies, all the delegates, then I think that will help get the word out, and then people are more aware of what services they can tap into. That's it for me, my spiel.
Thank you so much, Angie. We're definitely making note of that, and we have the people that can make it happen here on this call. So I saw Tamara taking notes, and I'm sure Will too. I see Miss Catherine Moore's hand is up, so yes, please feel free to unmute.
Okay, what we also was doing with community engagement is having some of the programs that were working with us do some socialization workshops with us to sort of let the clients know what kind of services they have for them, because during COVID, everybody didn't know what was going on, didn't know if they could reach it or access it or anything like that. So we had, I know we was working with the UIC with their reading program, and they came on and they did a virtual teaching parents how to do short story time, and they taught them how to get into the read along books that were on on YouTube and things like that, in order to give the parents some things to do with the children while we were all in COVID and could not really get, out to the different programs and stuff. So it worked out really good with us being able to tap into our community engagement community in order to help continue giving services while we were all in that.
Thank you so much, Ms. Moore. That is very helpful to know. And it's great that, these folks are doing exactly what, you know, they've been contracted to do. But we will make sure that, you know, what Angie mentioned is to provide maybe like a virtual, you know, welcoming or Tamela, I don't know if you want to add to that.
Definitely. I know even pre-COVID and pre layoffs and people leaving, Sharita had these meetings, and I know how important they were. And I do realize right now, like as Angie was talking, I was like, oh my gosh, yes, we had all of our service providers there. But I also was thinking like another area in which I forgot to ask a question about was father involvement. And we see, and oh gosh, post-COVID, the numbers are like at 0. But I realized UIC this year developed a dead cohort, and I don't even think that got out to agencies, because I think right now we only have 12 deads enrolled. And I'm like, wow, but that was a peer group. And I know during COVID, I met a couple of single dads at the parent cafes, and I was like, wow, you know, we are so involved in moms and what moms are doing that we forgot about our single dads. And UIC kind of scooped in to really support them. And I hope you guys, if you haven't checked out the link, please share that information with the fathers, so your father involvement can move up, and so that you can say, oh yeah, you know, we referred our fathers over to UIC, who's doing a great job in this cohort. Oh, it's just heartbreaking because they do have all of these services, and because we have not met. And I think that that's what we kind of dropped the ball, just to let you guys know what we have available. So I love the feedback. I wished I could do more. Hopefully me and Will, after this, we'll get together and we'll figure out, you know, next steps.
Thank you, Tamala. Yes, and we're going to make sure we add this to the self-assessment report. And I know in our next meeting for Q3, the committee is going to vote on like recommendations for the action plan. And so, yes, we'll move from there. Okay, so I think if there's any more questions regarding family community engagement, or just any thoughts you'd like to share, now is the time before we move on. No? Okay. Thank you so much. So we're going to move on to the survey questions that agencies answered. And if Matrice could jump on.
Yes, ma'am. Rate the program's responsiveness in supporting family services in person and or in a virtual environment. So we have food insecurities. Let's see. Let's look across to see where agencies could improve maybe. But for the most part, the agencies are doing well. Need some development. That's only 7%. Well, that was only 5 agencies. Do you know who those 5 are?
I do. I would be able to, let me see, this is question 16. Something that I wanted to note on here, it looks like unemployment has, oh, let's see here. No, the highest need would be preventing homelessness. That probably has had the highest, needs some development. So here, okay, I'm in question 16. So I'm in question 16. And what specifically did you want to know, Matrice? Which
food insecurities?
Okay, who were those 5 agencies? Yes. You know what? I probably can't share that.
Okay, well, don't share it. However, I will ask that the agencies go ahead and unmute and share thoughts about the food insecurities or any of those areas that need some development, or not applicable. And sometimes it could be not applicable because maybe you haven't addressed it, but let's discuss that, because the food insecurities, that's something that, clearly there's a need. But if the agencies are having difficulties in meeting that need, we would like to know about it.
So the way that I'm reading this is that for food insecurities, I would say the great majority are capable, or it's a clear strength. It's between that. And very few either need significant development or need some development, which is about what, 6%, 8%, 9%. And so I thought that was interesting because I know a lot of our agencies that are like in the West Side particularly are food deserts. And so I wonder, if their partnerships with like food banks have really stepped up, and that's why this food insecurity is lower than I would have expected it to be.
Okay. All right. So the child maltreatment factors, for the most part, it's capable of ineffective, very effective, and clear strengths. And there were a total of 5 agencies, well, between need some development and not applicable. And then back to the preventing homelessness, 13 responses. And then healthcare. Does anyone from the agencies want to speak to this? Well, it really wasn't a question, but rather a statement.
So the way that I'm reading this is that a lot of the agencies here, at least from the options that we provided, like food insecurities, child maltreatment factors, preventing homelessness, healthcare, unemployment, and transportation, it looks like they are pretty effective or capable, or it's a clear strength. And so I wonder, like, are there any options here or programs that we should have listed that are not here, perhaps? And that's a question for agencies. Is there something on here that we should have listed that's not here?
Hi, Bernice, this is Angie. I just want to speak to, in regards to the preventing the homelessness. During the pandemic, of course, there were additional financial resources for parents to access to prevent, like the rental assistance and things like that. But we have some families who are living with someone. So they have a place to stay, but sometimes that often turns into something that's short-lived, where they are receiving notification from that person that they need to move, or they're having issues living with that relative or things like that. And so they're like, they're on that timeline, like, mom or grandma or whoever they're living with says, hey, you got 30 days to get yourself out of here. And we really have no place for them, to refer them for getting low income housing, because they haven't been working. They really don't have any source of income. So it's like in those situations where families are, they had us, well, I'll just say stable housing, but yet they have to look for something else. So it's in those instances, like, where do we refer them? Because we know public housing, that's a long wait list. Even though those lists open, it's, that isn't something that they're able to access within 60 to 90 days, and they have to move. So, they have to move from that stable location to, a friend's house because, mom said time's up. So they're hopping from place to place. And, we had one family that, they had packed up their stuff because of a rental assistance, but we got them access to the rental assistance for that. But just speaking for the families who are living with someone, but yet have to move and they have no resources or places that they can go because they have no income. They're receiving medical and SNAP benefits, but that's about it. And then a lot of them, can't work or choose not. A lot of people have chosen not to work. We're finding that out. So it's like, okay, you need to move, but we need income because we don't have housing that we can just say, hey, we got emergency. ADAS McKinley got, we have emergency shelter, but that's what our foster children. So we don't have those type of resources for low income housing or places parents can access with no money down, no security deposit required, nothing. So that might have been something that I know ADAS McKinley, I think we answered that one on preventing the homelessness. So I think resources are needed in those particular situations where parents need a place to stay but have no resources, to pay rent, and, and things like that. So I know that's one of the reasons why I picked that. So.
Thank you, Angie. We're definitely going to make a note of this in our self-assessment report. And I know in the past, I believe this has also been mentioned, and we talked about, seeing how CSD can also work with our homeless division here, since we're also in the same building, but we're also in the same department. And so I don't know if those conversations have happened, and if they did, what was the outcome of that? But it's something that we can, put in our report. And then, Matrice, I don't know if it's something that you can speak to in terms of maybe how we can see how these conversations can happen, or if we can look into if they have happened and where are we there.
We can definitely look into where the conversation is happening. In addition to that, I would suggest, if you haven't already done so, to create a partnership with your local family and community resource centers, because they have the ability to provide these resources that families are missing. And that, just in layman's terms, that's the public aid office. So wherever the nearest office is, they have a listing, a booklet of jobs, housing, shelter, food pantries, and of course, families who have children over the age of 18 who don't have their own children. They are mandated by the federal government to seek employment in order to keep SNAP benefits. So their resources is just a matter of going out and having a conversation with those local office administrators to get the services that family needs.
Thank you, Angie and Matrice. So we have about 7 minutes left in our meeting, and we have a few slides left. So we might zip through those, but at any point, feel free to unmute, interrupt us, and we will make a stop.
Okay. And it's just the rating scale 1 to 8, rate the needs of families based on the frequency of request. And then a scale of 1 to 6, rate the gaps in addressing family needs within the community. Rate how well the program supports parents in strengthening their parent skills. So for the most part, it's very effective. Rate how well the program implements the parent curriculum. Across the board, I guess it's a coin toss between being effective and then needing a little bit of development. And that can go back to just additional training for the agencies so that they can relay that information to the parents.
You know, this one's interesting because in the other ones, we've seen a lower need for development. So if there's any of our agencies that could maybe provide us with an example or an insight. All right, folks. I know it's Wednesday, but we're almost nearing to the end. So I'll go ahead and continue on.
All right, you made it to the end. I definitely told you guys yesterday, you had to get over the hump. Now it looks like everyone is struggling to get over this little hump. And it's almost 11, don't go out and take a walk. I'm not going to suggest the walk today is miserable, so don't do that. But the next meeting, the quarter meeting, July 13th, you will receive the Zoom link closer to that date. And we'll go over the recommendations for the action plan and provide any Q3 updates. So drink plenty of water, stay hydrated, stay in a cool place, and check on your elderly and your loved ones during the heat. Anything else, Brittany?
No, just I will be sharing the slides and the recording with everyone. There's also some items that we are going to follow up with in terms of documents and answering some questions. So you should be receiving some emails from me in the next coming days. So thank you everyone for your input, your insights, your questions, and your time. And stay cool.
Thank you.